One.
Hi, my name's Heather McLean and we are here with Heather's Health Talk today. Today I'm going to be interviewing Joann Vollmer from the Wise Way Wellness Center in Thornton, and it's a gorgeous addition to your home. It's just amazing. So Joann is an herbalist. She's also a massage therapist and a Reiki master. Today, what we're going to be concentrating on after we go through a few things and she tells us about herself is we're going to be talking about her specialized technique called Arvigo technique of Maya abdominal therapy, which is a long way of saying this is a specific abdominal massage. And we're going to talk why that's important to women's as well as men's issues, how it can be part of a nice therapeutic treatment that could be within your realm of holistic treatments for treating several different conditions. So welcome, Joann, and it's absolutely lovely to have you invite us into your wellness center.
Thank you, Heather.
And
I'm really happy to share.
It just gives me chills. So today what we're going to do is start with just having you tell us a little bit about your center, how you got into it, and the things that you do here before we get into your abdominal massage.
Okay, great. So this is Wise Way Wellness Center, and I have been practicing massage therapy. My license began in 1988 and built this building to have my practice here in 1993. So I have been continuously adding and growing very organically. So as you come into the property, you will see several things outside. Most notably would be the medicinal herb gardens, where I gather some of the herbs that I work with, and also the geodesic solar grow dome, where we do grow year-round. And we'll be talking about that more another time. Mm-hmm. And then you come into the office, and I have a treatment room here, as well as a sauna, and also do some herbal and medicinal detoxing baths here in the summer. So going back to my massage license and getting into massage therapy, I'd always had an interest in holistic lifestyle even before, and was guided to become a massage therapist, and gathered many techniques along the way, working with aromatherapy for one. And then I also spent a number of years doing my herbal training, most notably with Rosemary Gladstar, who is over at Sage Mountain in Vermont.
She does a lot of courses, right?
She does wonderful apprenticeship courses, and studied with her for several years. So I have a background in formulating some of the teas and tinctures as well. So I became interested in the Arvigo Mayan work back in the late 90s. Wow. Is when it first came to my attention. Okay. I began to hear stories about an American woman who was in Belize, who was working with a Mayan medicine man, which is the equivalent actually to a surgeon in our country. It's a different tradition, and again, traditional healing all around the world is very different than what we have in this country.
Right.
And this is a traditional healer and a traditional healing system, meaning that these techniques and natural way of working with the body, mind, and spirit, these techniques are very old, hundreds if not thousands of years old, and the traditions have been passed down from medicine person to apprentice. There isn't actually books or a school or degrees that we have here, but they are ages old traditions that are passed down. So I heard about Dr. Rosita Arvigo, who was down there studying and working with the medicine man Don Eligio Ponti.
And now there are books about him.
There are books about her story.
Okay. with him.
And this is the first book that I picked up in the mid to late 90s. It's called Sastoon.
Okay.
And it is the story, Rosita's story, of how she came to be in Belize and meet Don Eligio and how she became his apprentice. She worked with him for 10 years, and he at last passed away in 1996 at age 103. And he worked with the people in his village up until about that time.
That just kind of makes me feel, I just feel that so deeply, that here's something beyond what we do in the United States and our current medical model. It's based on pharmaceuticals.
Yes.
And
yes.
Yeah, so this is such an alternative that people need to become educated on so that they can make informed choices in their own healing, in addition to what they're already doing.
That's so true. That is so true. And a lot of research was happening in the mid-90s as involving the New York Botanical Gardens, and a lot of information was gathered, plants were gathered, tested in the labs for their medicinal properties to treat our Western illnesses. So there's a lot of research that was going on. Another one of the books that came from this research is The Rainforest Remedies, which talks about a lot of the different herbs that grow there in the rainforest.
Right, and that is something that is actually in danger right now.
Yes.
Okay,
Yes.
so this supporting these remedies and supporting this kind of natural healing helps the rainforest.
It does, it really does. And Don Eligio was just an amazing healer, and his knowledge was incredible. Like we said, in that tradition there were no encyclopedias to read about herbs. He had 500 herbs and their constituents and how they work in the body, all in his mind. He said it's here, it's all here. He knew at least 500 of those rainforest plants and how to use them in traditional healing.
Wow.
He was an amazing man. So Rosita worked with him for 10 years. He did pass away, and during that time she began to formulate a teaching protocol so that she, in her promise, could take this work and pass it on for others to learn how to work, both with the plants and also with a very simple massage technique that Don Eligio would use on his patients, working with the uterus and helping the uterus to be in its optimal position, and helping people to heal many different symptoms, which we'll go into in a little bit. Dr. Arvigo was also a naturopathic doctor. Her training was here in this country.
Okay.
A naturopathic doctor is like an offshoot of chiropractic. Naturopathic doctors work with the muscles, the tendons, and the ligaments in the body.
I've never heard of that.
Yes.
Oh.
No, we don't hear of that so often. So she took that background and that knowledge to explain why this massage was working.
Okay.
How it affects the organs in the abdominal and pelvic region. So blending her knowledge with the traditional knowledge and the hands-on work is how this training in the Arvigo techniques was created.
Okay. Okay. So now let's get into this Arvigo technique and talk about, first of all, why the pelvic region is so important and why it's been ignored by the conventional Western medicine as being normal to have your uterus tipped and have bladder problems as you get older and other issues that happen to people as they age. And so let's begin with that.
All the conditions that you mentioned are not normal. They are signs and symptoms that there's something, an imbalance, that the body is not in homeostasis. The body and nature is self-healing and self-regenerating, self-renewing, and balancing. If we remove obstacles to that happening, the body can heal itself.
Okay.
So that's an underlying premise in this work. So what we see is through injury or trauma and other conditions that happen in the body, often we'll hear about the tipped uterus or the prolapsed uterus, bladder problems, and so forth. Any kind of injury or trauma has set up an imbalance. What happens when there's an imbalance is that we call the 5 flows. They're arterial and venous supply, so the blood circulation, the lymph, the nerve, and the chi are affected by an imbalance in this structure. So when we don't have arterial supply, we're not taking nutrients in through our blood system. And the venous return, we're not clearing the waste. And when lymph is compromised, we're again not clearing toxins from our body and begin to have a buildup and congestion.
Yeah, I wanted to just briefly stop for just a moment in the lymph system, because I know before I started learning more holistic practices that I imagined the lymph system was kind of all over the body and that magically it just sort of worked. But what I came to realize and have come to learn is that almost 80% of it is all in your digestive tract, right? And, okay, so if you have things kind of impinged or the blood flow is not going in there, you're not going to have as much use of your lymphatic system, right?
That's correct, and it is correct that the lymphatic system, those lymphatic, very fine lymphatic vessels cover the entire body, really. And then we have deeper lymph nodes that we know about in certain areas where we have the deeper lymph nodes. And yes, it is true, there's a lot of lymphatic vessels that run through the abdominal area. And again, with these major organs being out of balance, compromising what is just such a central operating center of our being. It has, very strong repercussions through the body. Right. So it's important to think about that. And then also is nerve supply. If there's a compromise on our nerves getting the messages through, we can have a lot of problems with our hormone system, for one.
Okay. And
chi, which is the universal life force that flows through our bodies. It's an invisible life force. The Chinese call it the meridians, and blockages there just deplete our vital life force.
Right. I think a lot of people may not understand that what you can't see doesn't mean it's not there.
Correct.
So yes. It's like this electromagnetic field around us that is definitely affected by our physical health. Is that what you're saying?
Yes, physical and emotional.
Okay.
And it's very important to include our emotional health as well.
So when you do this work, do you find that you affect people emotionally?
The work itself brings balance to the emotions. And just a little bit about the spiritual healing part of the Maya tradition. They do not separate body, mind, spirit.
Okay.
It's all a very integral part of each other. So in other words, when we have emotions like shock or trauma or fear or sadness, broken heart, jealousy, emotions like that have an effect on our physical body. They help to congest that physical body and bring the person off balance. So when we're doing this work, the structural work, sometimes that opens up a clearing and brings balance, and people feel lighter. Some of those things just lift.
Okay. That's a good way of putting it.
Yeah. It's very simple and very beautiful. And a very important part of one another.
Oh, I like that. So now let's talk about what kind of symptoms that one might have if they're having an imbalance in their whole pelvic region.
Okay, so for women, We can start with painful and irregular cycles, which is very common in women and a lot of young women just starting out with their cycles. We have things like cysts, ovarian cysts,
Okay.
fibroids, endometriosis.
Mm-hmm.
We have other symptoms such as, we can go into a whole list. Let me pull this out and make sure we talk about all of these. Bladder, uterine, and yeast infections is a sign and symptom of an imbalance. PMS and menopause symptoms. And then the prolapsed or the tilted uterus, which women will commonly hear being spoken, and in Western approaches they will say there isn't anything that you can do.
Right.
But we can go into that in a few moments. Fertility challenges and chronic miscarriages, and that's happening more and more often as the young women are attempting to have pregnancies and to maintain a pregnancy. Mm-hmm. And we're seeing that a lot. There's a lot of environmental factors and stress happening here as well. And this work also helps to enhance a pregnancy symptoms and helps to have an easier labor and delivery.
Wow. That's
so really most of your female health concerns and conditions can be helped and have an effect with this work.
Now, what about the digestive symptoms?
Yes, and then we can go to digestive systems, and we'll have things like indigestion, colitis, irritable bowel syndrome, and all of those kinds of symptoms, again, can be helped with this abdominal therapy.
Okay, and even men can be helped.
And men as well, absolutely, for prostate conditions, for prostate swelling.
Okay.
And working with that.
Okay.
Yeah.
And my other thought was, when I hear the Arvigo technique, I want to say, is it just for older women? But then you mentioned it's also could be for younger women who are having painful.
Yes.
Painful periods.
Absolutely. A lot of the teenage women, teenage women and young women in their 20s, absolutely. I've seen some wonderful successes where young women have just not been able to go to school or go to work because of those couple of days of severe pain.
Yes.
Are now able to function in their life. It's remarkable.
Wow.
It's remarkable to do this work and make these corrections, and also teach them how to do the self-care massage. Now that's another part of the treatment. When a person comes in for the Arvigo therapy, we'll go over a full intake form and their personal health history. So there's a lot of different things I'm looking for, and we take some time to go over that. They give me a highlight of what we might be addressing.
Okay.
So we'll go over an intake, and then we'll go in on the massage table and do the body work. Now the body work includes quite a bit of work on the low back, the sacrum, and the tailbone. Often people have injuries to their sacrum and tailbone.
That's me.
And that affects your internal function in the abdomen, very much so. So we do a lot of work on that low back region. And then the massage work is done on the front. It's all external work that's done. And at the end of the treatment, I teach the person how to do that self-care massage on themselves so they can continue to enhance the treatment at home until their next appointment when they come in. So, and then there's also other herbal recommendations that I might offer, diet, nutrition, lifestyle, other things that we use in this system.
Okay. Wow. So it doesn't hurt to get this massage, or is it uncomfortable? I mean, how does that go?
I work with people often. There are times when people might feel a little, how shall I say, just a little fearful or a little shy about having their abdomens massaged, and just to know, and I always like to let them know, you are draped and covered, because some people sometimes feel modest, and that's always very, much respected. And the massage, I work with each individual. Sometimes a very light touch is just right for a person, and sometimes it's a little bit deeper. We work with the breath, and that helps, and that brings oxygen into the tissues and helps very much. So I wouldn't say it's painful. It should not be painful.
Okay.
But we work with the body.
Okay.
Yeah.
Now, I guess one of my other questions would be some of your success stories, so that people can see like a kind of a real life example without names, obviously, but some of the things that you have found most impressive, or that have struck you, that kind of make you want to keep going. You know what I mean?
Yes.
You get those moments where it's all worth it.
Wow. Yes. And I could probably think of clients that I've been working with for almost each of these signs and symptoms. I guess, off the top of my head, I'll just think of a young woman who I've been working with for a number of months now, and initially just the painful cycles, horribly painful cycles that would put her out for several days.
Wow.
Not be able to leave the house and go to work.
Oh.
And on top of that, fibroids.
Oh, okay.
So we began the work, and slowly came some improvement. And I like to ask people to give it at least 3 months before we can really see, especially for some of these signs and symptoms that have been going on for years. We don't correct this overnight always.
Yeah.
It takes dedication for the client to continue their self-care and the other recommendations. So there's a little bit of lifestyle change for that long-term healing that we're really looking for. But we worked together, and over the first 3 months, working with her once a month, we did see that those cycles easing up.
Okay.
There was a clearing, a little bit of clearing. Sometimes you see conditions get a little bit worse before they get better, because it's a clearing.
Detoxification.
It's a detoxification.
Yep.
That clearing needs to happen.
Yeah.
For that balance to happen. So, and then over a few more months of her diligent self-care and coming in for those monthly treatments, she went back to her nurse practitioner, had the tests made that we can, verifiable ultrasounds, to see that the fibroids had disappeared.
What? They disappeared?
Gone. So,
wow.
Yes. So we're seeing, we can see this in tests, in working in conjunction with our healthcare system. We can see these things happening. So that's pretty exciting.
That is exciting. And I can see, so if somebody has sort of a tipped or a prolapsed uterus, for example, I can imagine that you could do some work to kind of straighten it out, but it's been so used to being in that position that it might take a while, it might go back to where it was at first.
Right, so we're working with the ligaments. So just a little very basic anatomy, which is important to understand. When we look at the pelvic cavity, the pelvic structure, and the uterus sits in the center, and the uterus is like a balloon. It's an organ that's free floating.
Yeah.
It's suspended by the pelvic floor muscles, and it is suspended and supported by sets of ligaments that hold it in place from side to side and from front to back.
Okay.
But the uterus is free moving. These ligaments are really important to that suspension. Yeah. So any trauma or accident or injury, these ligaments can get stretched or pulled to one side or another, pulling the uterus with it. Okay. And it can stay in that position. So when we do the massage, we're working with the ligaments. Okay. Helping the uterus to be in its optimal position. And that's why the home self-care massage is really important for the client to continue with. So if we have the uterus and we call it tipped or tilted, and that can be either forward, backwards, side to side.
Okay.
There's any number of those positions is the tipped uterus. So if the uterus, is leaning forward over the bladder, she's pressing on the bladder. So we have incontinence, and we have a lot of bladder infections and different signs and symptoms of the uterus pressing on the bladder. If the uterus is tipped back, often the uterus might be pressing on the colon. So we might have some of those elimination concerns that are happening and toxins building up.
Okay.
Again, we're looking for balance and homeostasis of all functions.
Right.
By that, by the uterus being in that optimal position.
Right. So it allows the circulation to open up and do what it has to do.
Correct.
Hi. We're going to finish up today. It's been fantastic talking to you. I have to say thank you so much for having us, inviting us into your home and your Wise Way Wellness Center. It's just such a unique expression of who you are. And we kind of concentrated on one of your success stories, but there are so many more to share. And if we had time, we could sit all day and share them. But what we'll do now is I'm going to ask you to give your contact information if anybody has any questions that they might want to ask you about this subject. Where can they get a hold of you?
So they can email me here at wisewayflora@yahoo.com, and I'd be happy to communicate with you. Thank you.
Thank you, and I wish you the very best success in your venture with this. And also, the next time you come onto the show, I think we're going to have to talk about your geodesic dome, where you can grow vegetables all year round, even with snow covering the dome. And it's completely solar geodesic grow dome. I don't think I said it right, but that was close.
That was great, Heather.
Thank you.
Good, and that will be great fun in the winter.
Yes.
Okay, thank you.